Okay, so I did my presentation on asthma. The etiology: asthma is a mild to severe reaction to an allergen. These reactions are called asthma attacks. The cause of a person developing asthma is unknown. Asthma is characterized by attacks of breathlessness, tight chest, wheezing, and coughing, which are caused by the airways becoming narrowed and inflamed. Some people may suffer with these symptoms all the time, which is chronic asthma, or others may be normal between their attacks. Here's just a picture of on the left side, which is labeled B. That's a normal airway, so it's nice and smooth, and it's able for air to flow through it freely. C is during an asthma attack, you see the smooth muscle around the walls is inflamed and thickened, and it's also producing a lot of extra mucus, and that's what really causes that blocked airway for people when they have an asthma attack. So that's what's preventing them from being able to breathe. So during an asthma attack, what happens? An asthma attack is a sudden worsening of asthma symptoms due to exposure to an allergen. The muscles in the lungs around the airways tighten, just like we saw in that picture, and those are called bronchospasms. The lining of the bronchioles becomes inflamed or swollen, and a thicker mucus, which is thicker than normal, is produced. Symptoms of an asthma attack include severe wheezing, difficulty talking, pale, sweaty face, blue lips or fingernails, and that's just from the lack of oxygen from not being able to breathe. Retractions, tightened chest and neck muscles, and then coughing that won't stop. And you're coughing just to try and cough up that mucus that's blocking your airway. Some cause and risk factors are airborne allergens like pollen, animal dander, and mold, which are pretty common allergens for people. Respiratory infections can bring on an asthma attack, physical activity, cold air, strong emotions or stress. Having a family member with asthma, that's going to kind of be a risk factor. You're more likely to have asthma if you've had people in your family who have had it. Being overweight, having that weight on your chest, and then having that, I guess you would say, having that susceptibility to asthma, having that extra weight on your chest really keeps and increases your risks. And then smoking, that's like a no-brainer, I feel like. Um, and the physical activity in the cold air, a lot of times people get asthma in the wintertime after they go on a run or something, and they go from the cold air to warm air or vice versa, and they really get that tightening of the chest and the coughing. Okay, so there are different types of asthma. One is exercise-induced, and that's kind of what I just talked about. Airway narrowing peaks 5 to 20 minutes after exercise or physical exertion. It may be difficult to catch your breath, and symptoms like wheezing and coughing can occur. Cough variant, its predominant symptom is severe coughing. This type is vastly underdiagnosed and undertreated and can occur due to respiratory infections or exercise. So they kind of get that one mixed up, and that's why it's really kind of hard to kind of pinpoint diagnosis, I guess. Occupational asthma occurs due to workplace triggers. You may have symptoms such as runny nose, congestion, eye irritation, or cough. Common jobs for this to occur include woodworking, animal breeders, hairdressers, painters, and farmers. I mean, that's just being exposed to an allergen that really kind of triggers your asthma to begin. Nighttime nocturnal asthma is if a person already has asthma, the chances of having symptoms at night are much higher, especially during your sleep. Asthma is powerfully influenced by the sleep-wake cycle, which is your circadian rhythms, like we learned. And due to the hormones that are released during sleep, they really trigger asthma. So studies show there are more asthma-related deaths at nighttime, as opposed to just the other types that are listed. A variety of illnesses can mimic some of the same symptoms as asthma. Cardiac asthma is a form of heart failure. Vocal cord dysfunction is abnormality of the vocal cords which cause wheezing, and that's frequently misdiagnosed as asthma. This is most common in young females who have loud and dramatic episodes of wheezing that do not respond to medication. So a lot of times that's confused as asthma, even though it's not. So if they don't respond, then it's obviously not asthma. Some statistics for the period of 2008 to 2010, asthma prevalence was higher among children than adults, which I feel like most of the research I did, most of the time it's more common in children than it is in adults. The number of people with asthma continues to grow. 1 in 12 people, and that's about 25 million or 8% of the US population has had asthma in 2009, compared with 1 in 14, which is about 20 million or 7% in 2001. So it has increased some, um, which is probably, it could be more now. I tried to research and it wasn't showing me very much. For the period of 2008 to 2010, asthma prevalence was higher among multiple race, Black and American Indian or Alaska Native persons than white persons. After looking that up, I couldn't really find anything on that. I mean, I'm not sure if it kind of depends on where you're living, or is a job more prevalent in that kind of other races than white persons. I'm not really sure. In 2008, asthma hospitalizations were 1.5 times higher among female than male patients. An estimated 300 million people worldwide suffer from asthma, with 250,000 annual deaths attributed to the disease. And that's actually quite a lot. According to the CDC, there is no known reason as to why the asthma rates are rising. It's kind of hard to tell. I mean, they're not even really sure what causes people to have asthma. So continued research is really kind of trying to figure all those things out. Some ways to diagnose asthma is physical examination to rule out respiratory infection or chronic obstructive pulmonary disease, which is COPD. Pulmonary function tests can be used to determine how much air moves in and out of the lungs as you breathe. These tests include spirometry. It estimates the narrowing of the bronchial tubes by checking how much air you can exhale after a deep breath and how fast you can breathe out. Peak flow, this device that measures how hard you can breathe out. Methacholine challenge. The methacholine is an asthma trigger that, when inhaled, will cause mild constriction of your airways. So if you react to that, you'll most likely have asthma. So that's probably a really good indicator of it. And then lung function tests are often done before and after taking a bronchodilator, and that's just to compare. So you have that that information to compare to of what you did before and then how you are afterwards. Treatments for asthma, prevention and long-term control are key in stopping asthma attacks before they start. Treatment usually involves learning to recognize your triggers, that's taking steps to avoid them, and track your breathing to ensure your daily medications are keeping symptoms under control. Really avoiding your allergens is going to be your best bet of treatment. Sometimes it's hard, especially if it's like your environment that you work in, but that's really going to keep your asthma attacks down. Preventative long-term control medications reduce the inflammation in the airways that lead to symptoms. These medications include inhaled corticosteroids, so like Rhinocort is an anti-inflammatory. Leukotriene modifiers is Singulair, that relieve symptoms for 24 hours. Long-acting beta agonists, so Ceravent, that opens your airways. And then combination inhalers like Symbicort, which you see a lot on TV, contains a long-acting beta agonist along with a corticosteroid. So that really helps to open everything up for you. And most of the time, people who have asthma carry their inhalers around, or they have like a set time and schedule that they do their inhalers. Quick relief, so rescue medications are used as needed for rapid short-term symptom relief during an asthma attack or before exercise as a doctor recommends. So that's like, I guess that would be if someone was exposed to an allergen, they use their EpiPen. That's like a quick relief for people with asthma would be like short-acting beta agonists, albuterol. So that's what most of the time is in just your inhalers. That's a quick relief bronchodilator that acts within minutes to rapidly ease symptoms during an asthma attack. Oral and intravenous corticosteroids, so prednisone, that relieve airway inflammation caused by severe asthma. The success rate of asthma drugs is good. People who take asthma medication should track when they take their medicine, know when to increase or decrease the amount of medication based on symptoms, and avoid their triggers. Alright, the prognosis is good if the asthma attack is treated accordingly. A person's lifestyle will be different and they will need to be more cautious in order to avoid their triggers. It is important to come up with an action plan with your doctor in order to have the best plan of action if and when you have an attack. So you really need to know what to do when something happens. That way it can be treated properly. If a person goes untreated during an asthma attack, the lungs will continue to tighten, so much that a person may be unable to wheeze. This is called silent chest and is very dangerous. Eventually, the lips become blue, which is cyanosis. This is a sign of low oxygen in the blood. Without intense treatment, you could lose consciousness and die. Many people believe that the lack of wheezing is a sign of improvement and are less likely to seek treatment. So just because someone isn't wheezing, most of the time it's not a good thing. Just like if someone's really choking and they're not coughing, that's really, really bad. So the same kind of thing applies there. If they're silent, that's usually not a good sign. These are the sources that I used, and hopefully this was helpful and you learned all about asthma.